Okay.
And we're just going to wait a couple minutes before we start. Just give Gary a minute here to jump on.
Yeah, it looks good, Sean.
Okay.
Gary's coming in right now.
Awesome. All right. Hey, Gary. Okay, so everybody ready to start? We good? With the screen on, I gotta scroll over to make sure I see everybody's faces. Okay, all right. Well, let's get going. Adequate notice has been given. We are going to, just because we have it on the agenda, we're gonna, I guess, start with the pledge. So I guess, do you have well, maybe, Sean, do you have the flag in your?
I forgot the flag. I can get it in a second.
Zoom needs to add a flag option for stuff like this.
Yeah, they probably have one, David. We just haven't figured it out yet. All right, look at that, and we have a flag. All right, we'll just do the Pledge of Allegiance real quickly. I'm gonna stand up. All right, I pledge allegiance to the flag
of the United
States of America,
to the republic for which it stands, one nation, under God, indivisible, liberty
and justice for all. Okay, so we do have a review of our agenda topics, but I don't know that there's nothing that we need to add. I don't think.
So the only reason I put that on there is because we didn't know if there was going to be another agenda item, and actually we're just going to stay to our focus on our return to learn plan.
Yep. Awesome. Okay, so we're gonna thank you. I just want to say, first of all, on a Saturday, thank you all. This wasn't a scheduled board meeting, so thanks everybody. But obviously we have this is certainly different times than any of us have ever experienced in terms of a global pandemic. So we called this meeting to really look at our and discuss and hear from Sean about the return to learn plan. So I'm gonna turn it over to Sean.
Okay, can you guys hear me okay? All right. I forgot to bring my earbuds in this morning, and I apologize. So I just want to make sure you can all hear me okay. So as Joe said, I would want to echo, thank you so much for coming in on a Saturday. And really the purpose of this meeting is to check in with you and to give you an overview of our return to learn plan. And I feel as the governing body of the district, it's important for you to be in the know, but also to give some input and for us to have some, some of your ideas that are part of this. And I will say that, through this last spring, I have been giving you updates at a board meeting and just sharing some things that we've been doing as part of the pandemic and our continued learning plan. And in June, I even gave us an update, and things continue to change. And so this plan is built to be agile. And so I think that, what I talk about today might change in a few weeks. So I just want us to be aware of that. So what I'd like to do is to give the board an overview. So I have a presentation that I would like to give you. It's going to take a little time to get through the presentation. And I'd like you to, as I'm going through the presentation, take some notes, and we will come back and we'll go through some protocols in terms of what are some clarifying questions, what are some things you're still wondering about, and then is there anything else that you think that we need to be thinking about as we move forward? So I'd like to do the presentation first and then come back to the board and get some input. Does that sound okay to everyone? All right. And I do want to say that it's really important to recognize the work of our central office administration, who has been helping lead most of this work, but then also our principals and then the teachers who have been integral to making our continued learning plan in the fall in the spring successful, and then how they've been able to give us some input how we're moving forward. When we started doing this work, we decided we needed to make sure that we had some guiding principles that we were adhering to. And those guiding principles we keep coming back to when we're thinking about our plan, making sure that the safety and health of our students is an ultimate priority, and also making sure that we are providing an excellent education for our students, no matter what it looks like. And so if it's remote, it's excellent. If it's in school, it's excellent. And that we also know that this pandemic has had some social emotional impact on our students and staff, and we need to make that a priority as well. We need to make sure that students are getting what they need and making sure equity is a part of this conversation. And then, as I said earlier, is that we need to be agile enough to adapt to public health conditions and fluctuate between different phases in our plan. And our plan, and when we've been working, we've been thinking about 3 focus areas. One is risk mitigation, another is health promotion, and the other is educational adaptation. And I wanted to give you just an overview about what we mean by that. When we're talking about risk mitigation, we're thinking about everything that would reduce the possibility of transmitting COVID-19 in our schools, and making sure that we have all the right plans in place for cleaning, making sure that we're holding ourselves accountable to that, thinking about ways that we're going to maximize social distancing. For an example, we engaged an architect to look at all of our spaces and all of our facilities to be able to see what our buildings could do, what capacity our buildings have in order to properly social distance within our schools. Looking at ways that we can look at our play spaces, thinking about how we transport students. And then one of the things is that we are a very open environment, and we have lots of visitors, but this is going to be a different mindset in terms of visitors and volunteers coming in the building and restricting that. And then just making some changes in different routines that will mitigate some of the risks that are possible. And the other thing that I really appreciate is that we've been able to develop lots of different graphics that you'll see throughout the district that have helped promote this risk mitigation. When we're talking about health promotion, is that there's an education piece to this, and we need to make sure that everyone is aware of our safety protocols. We need to make sure that we have people aware of why we're doing certain things, and making sure that we're educating our students and our parents and our teachers about the best ways to promote health within our environment. That also includes that people understanding the guidelines for social distancing, having daily health self checks, and then also making sure that we have all the right plans in place for if we would have a member of our community being diagnosed with COVID-19. And then the other major component of this is that we've developed a whole plan that is separate, that's focused on social emotional well-being of our students. And we've had some people work on that I feel really proud of. And the last thing is educational adaptation. The way we're going to learn is going to be different, and we need to make sure that it's continuous for all students, no matter who they are. We need to make sure that we're being equitable in all of our practices in terms of grading and assessments. We also need to make sure that whatever we do is we have to think about the different needs of our students. So what we might do for some students might be different than others, and we're taking into consideration our students that have IEPs and thinking that and our EL services and their services might look different. We also learned that we have to be really good at remote learning. And when we went into remote learning in the spring, we had to jump into it in an emergency situation. But now we've had some time to get feedback from the community, do some additional research, and develop plans that for remote learning that I feel like are highly effective. And that would include more synchronous approaches to our instruction, daily schedules, common expectations for grades, and also making sure that we have all the right materials and platforms we need to make that highly, highly successful for our students. as I shared earlier, we did get feedback, and I shared some of that data with you last week and a couple weeks ago in a report, and you saw that the data that we collected, it has helped inform this process, and we've really appreciated using that. And the other thing too is that over the last couple weeks, we've engaged a working group of 45 staff from across the district at different levels and in different positions, and they have been able to give us ideas and insight into our plans, and have helped us also change our thinking about some things, and they're continuing to do the work even in some smaller groups. And so they have helped influence, and they've been incredible. So I wanted to give you an overview about our plan. And one of the things is that we've thought about, like, how are we going to brand this? And our brand is our Return to Learn plan. And so there are going to be two different options for our families. We're going to have a responsive learning option and a learning at home option. And that I'm going to talk a little bit more about the responsive learning first. When we're thinking about responsive learning, there's three different options. We could be in person and working 5 days a week in our schools with precautions in place and having our regular offerings. We may have some different adjustments to our schedule, but it would be a 5-day in-person plan. The second part of that responsive learning would be a hybrid approach. That would mean that we would have a schedule that would have students in school and on remote learning. And the reason we would do a hybrid plan is to maximize social distancing and reduce the number of people within our building. And that would be connected to our risk mitigation. And then another part of our plan would be remote learning. And that would be that all students are fully learning remotely, and they would still be learning from their teachers, but with new aspects that would include daily schedules and synchronous learning. And so those plans, those different phases would allow us to, and we made sure that whatever plan we're putting in place or whatever we're going to do is that we have to be the very best at it. And I feel like we do a great job with in-person learning, but it would be very different in this type of environment with social distancing and some other factors. And then the other thing too is that we know that there's going to be some factors that are going to help that would determine where we are on that in that plan. We may have to move between phases for different reasons. Some of those reasons would be trends in cases of COVID-19 in St. Louis County. There might be a county order. We may have localized hotspots within our school. There might be staffing issues, because the reality is that we may have staff that are not able to be in school. And then also there could be a change in science, either like a vaccine or a new understanding of the transmission that might influence how we would move between those phases. Our learning from home plan was designed because we know that there are families that still are going to need to have full virtual learning and would not be able to bounce back in between the different phases. And so we're calling this learning at home. And we are going to give our families an option for a semester-long commitment, and this is kindergarten through 12th grade. And we are utilizing different platforms that are connected to the Missouri, the MOCAP, the Missouri Course Access Program. And what we've been able to do is to have partnerships with Ladue. And the reason why we're doing these partnerships is because we could be sharing resources across our district, but also we could have different teachers supporting our, we may have a class where we need to have a few students from Ladue, a few students from Clayton in the same classroom and sharing those resources. But then the other thing too is that by sharing those resources, we're reducing our expenses because there is a cost associated with using a third-party platform. And we've been able to reduce those costs because we are asking our teachers to become the teachers on these platforms. So by doing that, we're reducing the cost of them, but then we're also having Clayton teachers. And then we also know that these platforms, we've also been very cognizant of knowing what our expectations are for learning at home. And so we've been able to adjust whatever we want to do with these platforms to make sure that it has what we want in terms of a daily schedule, synchronous learning, and daily check-ins and individualized learning. So we've been able to take platforms and make it our own. And then also by partnering, we've been able to use resources that I think are going to help us be even more successful. And then the other thing too is that we are going to have consistent grading expectations, and people are going to have their roles really clearly defined. Students are going to know their roles, teachers will know their roles, and also parents as well. That commitment to the learning at home, we would, if people chose that, we would ask them to stay in that program for the entire semester. And so we didn't want, what we want to do is have continuity of education, but we don't want people bouncing back and forth. So starting from, going into learning from home and saying, well, you know what, now I'm going to go back to the responsive learning plan. We're asking people to make that commitment so that way there's continuity of learning. There's the question about mask, and we are going to require all district staff and visitors to wear a mask. We are providing masks and reusable masks for all of our staff. We're requiring students in grades K through 12 to wear masks and encouraging students grades pre-K through 2 to wear a mask. And listening to medical professionals within the community, this seems to be one of the best ways to mitigate risk within our environment. We are going to have daily health checks, and we are going to incorporate self-checks that are going to be completed by students and parents and staff. And that's going to be a checklist of, do you have these symptoms? Have you been exposed? It's a way for us to have our community monitor themselves. And if there are, and the other thing too is that might mean people, if they have any of those items on the checklist, they need to stay home. And so we are going to be very cognizant about promoting that. If you're sick or have any of these checklist items, you need to stay home. And we're not going to be promoting like perfect attendance or things like that, because we want to make sure that people are not bringing something into our building that could cause spread. We're also we are creating locations for isolation, and then we're also making sure that we have systems in place for contact tracing. Now, that is something that we're continuing to look at how to improve that. But at the elementary level, we could maintain students in cohorts. That's a bigger challenge for secondary, but we're looking at best ways to do that. And as I said before, an important component of this is the social emotional well-being. And we've had different members of our central office staff take lead on a lot of this work. So Melena's really focused on the curriculum and instruction. Robin's focusing on the social emotional support of our students. And so we are making sure that we are doing check-ins, collecting data and using some of our panorama data and making sure that we're seeing what needs are there. We will continue to monitor our students in terms of that have already exhibited high needs in previous years that, like last year, and making sure we're continuing to support them. We're going to make sure that we have those things in place like meals. We've been able to get waivers so that way we can continue to provide meals even when, during the school year, so that way we can make sure those needs are taken care of, that they're addressed as well. And then it's going to be important for our families to be engaged and understand that there are going to be new routines, and students, when they're home, they might act differently or react to those new routines, and how do we help parents support those situations. We know our staff are critical, and they are the ones that are going to be working with our students. So we are giving them some different options. They'll have an application to teach within our learning at home model. And we're gonna, we also know that there are some medical needs for our staff, and we need to make sure that we're addressing those as well. We are going to be putting in place assured professional development focused on highly effective virtual instruction as part of our opening to the school year, because we want to make sure that everyone has a clear understanding about what that looks like and their expectations. Making sure that we're building in time for staff check-ins, frequent breaks, and also creating a space that is safe for them to share their concerns. Now, when we're talking about public health assumptions, we know that there's, things are going to continue to happen without a vaccine. And we're actually seeing that right now in St. Louis County, is that we are seeing an uptick in the amount of cases that are happening within St. Louis County. This might mean that we have short-term closures. We know that some staff and some of our students are going to be higher risk than others. We're going to have to do a great job of teaching and reinforcing prevention behaviors, and then also making sure we have all the right systems in place for cleaning and disinfection. And when I think about these public health assumptions, some things have been I have been thinking about, like, how do we be responsive to these assumptions? Because it's going to be critical for us to be able to teach our students and our families about what it means to mitigate risk and for health promotion, because that's the only way we can get our students back into school. I want our students to be back in school, but I'm also concerned about the health and well-being of our staff and our students and staff. And I'm wondering a lot about, like, what can we do to possibly really invest a lot of time into teaching people about what it means to social distance, what it means to be in to have these new procedures in place at school, because this isn't about August 24th. It isn't about, like, what are we doing to start school. This is about, like, potentially years that we are going to have to change until we have a vaccine or something changes. And I want to make sure that we have the right amount of investment of time in educating our community about this. And so I wonder about some different ways that we could do that, and I can share that with you a little bit later. We are seeing an uptick in cases in St. Louis County. We just got noticed from the county executive that we are having to go back to phase 1 for youth sports. It's interesting, this past week, we had an emergency meeting with the superintendents on Thursday, because the St. Louis County Health Department is really concerned about what they're seeing in the region. And they actually were asking us to delay our announcements because they think that there's going to be an uptick even more. And even one county official was stated as saying, the safest way to return it would be virtual. And so keeping that, if we're thinking about the different phases, I think about, like, how do we keep our students in school for the longest period of time? Not just starting school because we need to start school, but is there ways that we can start school in a way that giving us time to make sure people truly understand what this means to be in a different type of environment. So one of the things I thought about, and this is not what I'm saying that we're doing, but if we would start remotely, we would have 5 days of virtual instruction. But I am suggesting that we spend that first quarter investing in time and educating and bringing small groups of people into the schools to teach them what it looks like to be in a classroom, to teach them the new protocols, to have orientations for our parents, to be able to assess our students and to see where they are with their learning and see where their needs are. So that way people could gradually get us to a point where they really, truly understand what it means to be in this type of environment versus August 24th, jumping in and doing that teaching. So I'm not saying we're doing that, but I will say that that's been something that I've been thinking about and talking with other school districts about, because I don't want us to be in a situation where we haven't done the right amount of invested the right amount of time about health promotion and risk mitigation education, and then having to jump back and forth from those phases because we're having an occurrence of COVID-19. We are sending out communication, even though we've been asked to delay it, I feel like our community still has to have some communication on July 20th. and we are going to be sending what this return to learn plan is going to look like. But at this point, I feel like we need a little more time to determine where we are going to land on that phase. So we're going to start giving our families an opportunity to sign up for the learning at home, and then we will make some decisions. I'm hoping by July 29th about where what phase are we going to start on for the beginning of this year. And so we're also going to build in some time for people to have questions and answers and in a virtual way. And then we're also going to set some guidelines for people to opt into that learning at home model. There are going to be financial impacts to this, to whatever we do. And fortunately, we have been able to be fiscally responsible. And the tax levy last year has helped us get to a point where we have a healthy fund balance. But in order to provide the highest quality and safe program for our students, we are going to have to do some investment with some additional PPE. We might have some additional staffing to support some of these ideas. There is a cost associated, although we're trying to reduce those costs, there are going to be costs associated with having those online platforms. And then we may have to do some adjustments with even furniture and spaces that are going to have some impact. And so a rough estimate would be between $500,000 and $700,000 that could be an impact to our budget. So I just said a lot. And so I want you to know that we have been working tirelessly trying to figure out the best answer to this. And I also am realistic enough to know that no matter what we do at the beginning of the school year, someone's going to think it's not the right idea. And I know as the lead learner of the district, I'm going to have to deal with that. But I have to make decisions that I think are going to be in the best interest of the health of our students and our staff and our families, and know that that I'm looking for long-term solutions to get our kids back, because I do think it's important for us to have that social interaction and the face-to-face, but I want to make sure we're doing it right. So I just said a lot to you, so I'm just going to kind of open it up, and maybe Joe, I don't know if you want to help facilitate that conversation or any reactions.
Yeah, I'm happy to. Will you stop sharing your screen though, so I can see everybody? It's easier
Yes.
that way.
Did that work?
Mm-mm.
No, oh no, sorry. I see it now.
Thank you. All right, Sean, that was really great. Thank you. I think that was a really very comprehensive overview for all of us. So I'll just open it up. Thoughts from the board?
Any clarifying questions that would be good to?
Staci, we'll start with Staci.
Okay, Sean, thank you so much. I mean, I can't even imagine how complicated this was, and I appreciate so much how hard you worked on this, and also want to thank you for involving teachers in the plan, because I think it's so important to have their perspective. I have a couple questions. One, are the teachers able to choose which way they will be teaching?
So what we're doing is we're having teachers, there's some factors that some of our teachers have medical conditions that would be best for them to use an online platform, and we're working to accommodate those first. And then we also have some teachers that are just really interested in doing an online way. So we're actually sending out an application process. We're going to prioritize those people that have medical conditions, but we also are going to see, what our need is for teachers, and then finding out who is interested, and then making some determinations about who we're going to put into those roles.
Okay, great.
No matter what, we want all of our teachers to be highly effective with remote learning.
Good. And I appreciate so much that there's such a focus on the social and emotional well-being of our students and staff. But I'm wondering, but I know this was so brief what you showed us, but you were mostly focused on checking in on them once school starts. I'm just wondering, have you been checking in with teachers now to see how they're feeling as we head into starting this? Because I am sure there's a lot of anxiety.
So, just having the working groups and having teachers, having times to interact with them. We had close to 50 people that were part of that. And I heard a lot from the group. We've done surveys, but also our teachers, which I love, is they advocate for themselves too. And so I'm hearing from teachers who are sharing their concerns, and I appreciate that. And so I will say that I don't think this is unique to Clayton. Teachers are worried, and they're worried about their health. They're worried about the impact not only on themselves, but they worry about their students. I mean, the impact, the impact that what I'm hearing from teachers, that they're worried about their students, but they're also worried about, those people that they're caring for in their lives. So, if they get sick, it could impact their parents or other people who are in their lives. So I don't think that's unique to Clayton. I think it's nationwide. I think people are worried about that. And
Yeah.
and I think that that's something that I have to keep into consideration.
Yeah, thank you. And I just have one more, more technical question. I don't remember this exactly. Are the MOCAP courses the same as the launch courses? And if not, have we considered using launch if we need to?
So it's MOCAP is the umbrella for all of those platforms. So we are planning to use for elementary, we're going to actually use a program that's out of University of Missouri. And so, and that is aligned with Missouri standards. So MOCAP has different choices underneath that umbrella. And we are going to use launch for 6 through 12. And so because launch allows us to fluctuate, launch is giving us a lot of leeway in terms of how we provide the instruction.
Great. Okay. Thank you.
Awesome. David, I saw your hand next.
Thanks, Joe. And Sean, thank you for the review. I agree with the points that Staci made. I have kind of 4 questions right now. So on, I guess not in no particular order, on the equitable grading piece, during the emergency learning, we saw that, there were more than a few students that didn't even log in, right? And we had, we were under the unusual situation of essentially a penalty-free box, right? We weren't really grading. There wasn't accountability. I'm assuming that we don't have that luxury going in, and I'll be honest, I hope we don't. I think we need to have an accountability component for grading. So do we have eyes on how we're going to manage people that opt in to virtual only and don't engage, or on the other side of that, we have kids that do engage, but they just are struggling. I think we're going to find ourselves in a rather unusual environment where we can't wrap our arms around somebody and help them as well as we would have in a classroom environment. I'm just, and if it's a really complicated, convoluted thing, I don't expect you to go into detail, but I'd just like to know that we've got eyes on that.
Yeah, definitely. And you're right. When we jumped into remote learning last spring, we had to almost develop a whole new model for what our expectations were. I will say that, some places were completely hold harmless, and we were not completely hold harmless with it. We did have expectations for our students, especially at the high school level, for completing assignments. When a student is going to be in that learning from home model, there are going to be grading expectations. It's going to be like they're committed to that. It's like they're taking the online courses, and it is going to be something that there are going to be grading expectations, and they're going to, be rigorous as well. I mean, there's going to be expectations. It's not going to be like a hold harmless. It's like if you're signing up for a college course online, you have grading expectations. If you don't make those expectations, there are consequences to that. Now, the other side of that is if we have to go into remote learning, and these are the students who didn't commit to that opt-in option, we are going to figure out a mechanism around attendance. And I say that loosely because we're not going to say perfect attendance when we come into, if we're in school, because I don't want people coming to school. But if they're online, we have to keep track of who is not engaging or not coming into the classes, And so we're thinking about how we use some of our ancillary support. So like some of those, so finding out what the needs are. And if there's students who are not going in because maybe they don't have the resources, or they're not having the time, or some support at home, we can use some of our ancillary resources like our interns or other support staff that could also be doing virtual learning with them, and going in and maybe doing a different time of the day that they're doing it. But there's still going to be an expectation that you're completing the coursework. And if there's a specific need, we'll address that and figure out a plan. But we are going to have the expectation that you're going to complete the work. And then if there's issues that are causing students to have trouble with that, we will figure out a plan to support them. Hopefully that answers.
Yeah, no, it does. Thank you. Yeah, I think it's all about expectations. And I like that we had an item on there that specifically called out, defined roles and responsibilities for parents, students, and educators. So I think that'll help. It's just it's one of those things where we've got to make sure, that people understand that, we're still going to carry a fairly, it's going to be different for us and a new challenge for families, because it's a different conversation of, I've got, I'll have a first grader and a third grader, right? So it's, the first culture shock I had at the end of last year was I had to sit on those video calls and push the mute button, so that my kid didn't dominate the video feed for, the classroom time, right? Because God love them, the kindergartners just cannot navigate a mute button. So, and that is, and if I do, if our family were to opt into distance learning in the fall, it's going to make the mute button look like a nice luxury, right? I think it's going to be a lot more complicated no matter how we slice it. So I think it's just about expectations and understanding. And a couple of other questions that are a little tactical. There's no mystery here. You guys know I'm a data dork, and my background was in science, and I am one of those guys that's peppering our county executive over, maintaining high risk behaviors, at the sake and sacrifice of our schools. So have the superintendents as a group collectively put pressure on our county government around things like bars and gyms? And hey, I don't want anybody to suffer, and I don't want any small business to suffer. But when I look at transmission likelihood, and I walk through downtown Clayton in the evening, and I see the proximity of what I see at some of our bars, I kind of have to shake my head. And so I don't mean to put you into a political spot, but I am curious if the superintendents are putting pressure on our county executive over other high risk activities, in light of what we're looking at.
So yeah, and I've seen it. I think there's an article that I've seen around that in terms of bars and gyms, and I will say not officially, the superintendents have put pressures on our county executives. One of the conversations that we've been having is, and just to be completely blunt, like I feel like our region and even our state has had not enough guidance in terms of like thresholds or data that, like, I look at other states and some of the school districts, their plans are like, when we meet this threshold, we're moving from this phase. Well, we don't have any of that data, like that. We don't have that kind of luxury. So we actually have been talking about how do we create those thresholds to help us. But I will say we've talked about informally those kinds of things, but we haven't officially made like a unified push. And I think part of it is because we're all in the minutia of all the things that are happening within our district, to be upfront. But no, yeah. I think it's a really good point, is that we all are part of a system, and the system, there's other influences that are outside of the system that are influencing our district as well, our schools. So, but no official push.
And then my last question is really around the budget piece. I spent some time with Mary Jo leading up to the budget approval that we did in June. And, we've got, and at that point, we had an understanding of some impact around, graphics and literature and, PPE for staff and help with kids. And, we've kind of got an idea in the budget at that point I don't know if I'd go so far as to say we have an accrual for it, but is the $500,000 to $700,000 impact that you highlighted there at the end, is that incremental to what we've already identified, or is what we identified in the June budget, is that inclusive of that $500,000 to $700,000?
It's inclusive of it. Inclusive
Okay.
of it. So it's what we've already spent, and then what we've already thought about. But also, at that point when we did the budget, we weren't exactly sure where we were going to be with the platforms for the online learning and what the cost would be for that. And then the other thing too is the staffing that we may need to support. So like we're thinking about ways that when we get students back into school, like there could be ways that we can hire additional interns that would be able to provide some additional support in smaller groups. So that's why we're also trying to share resources across districts, because if we're able to do that, we get a better cost for those platforms. And then also we're sharing resources of highly qualified people.
No, perfect. Thank you. I'll give Joe back the talking stick here. I appreciate it.
Thanks, David. Other folks who have questions? Amy?
Yeah.
Go
Hi.
ahead.
Am I good?
Oh, sorry. Go ahead.
Yeah, go ahead, Amy, and then Jason. You go after
Okay.
me. Okay.
So I thank you, Sean, for the presentation. It was great, and for all your hard work and getting that together with your staff too. I love that we have that the families will have options. I will say, and I understand that everybody has their own tolerance for risk with this, and it's all very personal. Where things are today, I mean, if I had to make a choice, I'd be choosing the virtual. And I am concerned about kids returning to school if things are where they are today in a few weeks. I'm concerned about kids returning to school. I'm wondering about the virtual learning. Will the kids, so typically they're in class, 8 hours a day. Would it be a similar situation that they're required to log in at certain times and they have learning, they log into a classroom, they see other kids? I'm trying to understand a little bit more about what that virtual learning looks like.
Yeah. So I purposely didn't put it as part of the presentation just because it still could be changed. But what we developed was a daily example schedule of what it would look like. And it would go from 8:30 to 3:30. And so like in terms of a check-in in the morning, a learning block, time for lunch and a break, and then again coming back to synchronous time, another learning block. And those learning blocks could be in synchronous instruction. It could be a video lesson. It could be that the teacher gives a mini lesson and then is working with small groups of students. And so we have developed for elementary, middle school, and high school what the daily schedule would look like. And we're asking people to adhere to those schedules, because one of the things we've heard is that consistency is going to be really important as part of this. But we also know that that's going back to David's questions. Like there are going to be times where people, how do we manage when people aren't showing up to those meetings? How are we going to make sure we're not missing somebody? And so we're putting in measures in place to make sure that we're finding those students as well. But yeah, it would be a daily schedule that is developed. Does that help?
Yeah. Yep.
And so
Thank you.
Milena has also developed a whole document that is, connected to everyone's role. So like the different stakeholders' role. This is the student's role. This is the parent's role. This is the teacher's role. And then how synchronous learning can look. And then even just like how we actually break down the courses. So not, like we're also cognizant, it's very hard for students to sit for a 7-period day. So like, how can we be cognizant of how we look at a whole week and how we're teaching the courses? So.
Okay, thank you.
Thanks, Amy. Jason?
Yeah, can you all hear me pretty good? Can you hear me well? All right.
Yeah.
All right. So just want to go back to what David asked. I just want to clarify the question and the answer. I think you were asking about, David, maybe you can help me out with this. I want to make sure I'm clear about this. But you were asking about accountability, essentially, right? For in managing expectations of what we should be expecting of the children when they're learning, as well as teachers, what's in being available and all of that. Am I right? Right about that? Yeah. So, Sean, can you kind of just like clarify that a little bit more? Your answer. I want to make sure I understood it well. What you were saying. Like how we're going to do that.
So what I was sharing is that we're going to have to put measures in place. So if we're doing like a virtual option, if we're in remote learning and we have a schedule of courses, if we're going to have to hold people accountable to doing the work, they're going to be graded for the work. And it's, we're holding them up to a high expectation. But we also know that we have to have measures in place to, if students aren't showing up or if they are not doing the work, we then also have a responsibility to say, why is the student not showing up? What is the impediment there? And then how are we going to fix that? It's not going to be enough we can't just say, 10% of our kids didn't sign in. We can't, because if we're doing remote learning, we have an expectation that all students are learning. And so that may mean that teachers might be held accountable to, like if we're doing the schedule, if Billy's not showing up for the schedule every single day or signing off, then we need to figure out what the why is for that. And then following up in some way. So that's where our counselors will come in place. That's where, our administrators come in place. And then we have to think about how we utilize our resources that we already have in our district to then put some additional supports in place. We did that in the spring as well. Like there were some kids who weren't signing in and so we called them and even some of our social workers did socially distanced check-ins with families and were able to get interns to meet with the kids. And it was maybe more about kids not being able to have someone support them. And so we needed to put the right supports in place. But this is going to be a little bit more a notch up because we can't afford for students just to fall through gaps. And so those are the accountability measures we're thinking about. So does that help a little more?
Yeah, no, it is. It's very helpful. It's also so in many ways that was a very good answer. I understand the predicament that you're in. It's a complicated process trying to figure out how we're going to hold folks accountable. Who, number one, parents may be a bit more laissez-faire, right? Number two, there are a lot of disparities that we're dealing with when it comes to kids who don't have the resources to log in every day, or a child's home may not be safe, or even the teacher's home may be complicated and wrought with who knows, anything, violence, whatever, instability. So I'm just trying to figure out how hard are we going to go? How hard are we going to lean in a direction of accountability this semester? Being it's still fairly brand new to us. Remote learning. That's my question.
Yeah, I think it's a good question, and
yeah.
And I think too is that we also know that people have their lives. I mean, a lot of different things happening. So like we have been thinking about, and I'm not exactly sure the answer for this, but like ways that we can support either families or teachers in ways that may be different than what we've done, and that different than people are thinking. So like, and I'm hesitant to say it, but like, is there ways that we can support with childcare in a different way that allows people to really focus on the work that they need to do? So I don't have all the answers for that too, because like there are the circumstances that are causing people to feel like they can't be held accountable to that. But the reality is we need to be, so that way we can provide the highest quality education for our kids. And so what can we do to look at our resources to think about ways that we can support people to make them highly effective? So Accountability is gonna be, and I will say, there's gonna be bumps in the road. No matter what we do, there's gonna be bumps in the road, but I feel like we have the efficacy to say, okay, let's address it. We've been able to do this in an effective way. And I feel very confident our team's gonna hold ourselves accountable to it.
Let me ask you this question. I know you're aware of what's happening. Everyone's aware of what's happening in our country right now, on the federal level and on the state level, and then even on a local level, with this misinformation, not really getting good directives from the federal level on social distancing and all that. How much of your decision is centered around the federal level, the state, and the county to reopen?
So, I mean, I have to look at all of that data I think that the reality is that what I've learned in this process is that everyone has different feelings about how to interpret data. And I think that's just a reality of just looking at data, but there are some that feel like, well, even though although there's an uptick in St. Louis County, as long as the kids have masks on, they'll be fine. But I think that the reality is just like, how much risk do we want to take? And I mean, I will say, I look at all that data. I look at the reality of like the discomfort of our teachers. I look at the families who have reached out to me as data. That's soft data, but it said, I don't feel comfortable at all being in a school. And I think that, I try to use the data that's in the county and using the St. Louis County Health Department to help inform this, because that's the more local. I don't base off what's happening more nationally. I think that we see that there's trends in different regions, but I really have to look at what the local data is showing. And unfortunately, the local data is not looking as good as we would want it to be. I was really, really, really hopeful that we'd be in a different place, and we're not.
Right. No, I mean, it makes a lot of sense. I mean, I think and your biggest concern, I'm assuming, is health and safety of like everyone in the school, like people getting sick, carrying the virus home, as we talked about earlier.
Mm-hmm.
Yeah, so I just want to make sure we're just having that, that conversation, and the public knows that you're thinking it from that lens. That's your lens, and that's how you're approaching the situation. So,
I think that someone recently asked me, well, like, what keeps you up at night?
Yeah.
And that's the thing. It's like decisions I make, how could that have an impact on someone's life? And it's hard.
Yeah, because you don't want to hurt. You don't want anyone to get hurt.
Right.
I mean, so yeah. So I mean, I think we all understand what you're going through, and we do appreciate you and the administration, what you all are going through, and what you all are putting together right now. So yeah, thanks a lot, man, for that answer.
Thanks, Jason. Kim or Gary, any questions or comments?
Sure. I have a couple still kind of in the mode of clarifying, I guess, for now. Sean, I know that we talked about if families choose to do entirely virtual learning, that's a semester-long commitment to do that. Can you talk about, because this is a question that I can anticipate, the commitment from the other direction, in terms of if someone starts with wherever we are on the phases of the return plan, and then something happens, maybe we're in a hybrid model, and then something happens, whether it's somebody does a comfort level, or somebody gets sick, or a relative gets sick, or there's a change in circumstances, and that family needs to make a change to virtual learning. Are we going to be able to accommodate that, or what would we do in that situation?
Yeah, I think that's a great question, Gary. And yes, we would be able to accommodate that. Our purpose in having commitment to that model is that we want to make sure that we, if we're having plans on having kids back in school, having the right numbers is important. But if we need, so that's why we're saying if you're committing, we want you to commit for the semester. So that way we're not saying, oh, you know what, I decided I'm going to go back, which then increases the total number of kids in classrooms. Then we have to adjust. But we do have a plan in place that if something happens and you're in that responsive learning model and you have to go on to that learning at home model, we can accommodate that.
Okay.
So I think that's a really good question. Yes, we would be able
The
to.
commitment is more, if you're making it virtual, we need you to stay there until we have a semester break to reevaluate class
Right.
size.
No,
But we have more flexibility to add to that. There's
right.
still some logistical challenges, I'm sure, but
Right, in terms of maybe where they are with the content, but that's something that we could work through.
right. And it sounds like with the under the MOCAP, you've got different launches, the 6 to 12, and then I can't remember what you said for the elementary, but so I'm guessing that the answer to this question might depend on the grade level. But you talked about wanting to use Clayton or Ladue teachers. When will we know whether that is in fact going to be the case? Whether it'll be all Clayton or Ladue teachers, or some people will have a Clayton teacher and some people won't. Like how would we know that? Is that based on the numbers? What would drive that?
So once we start getting, so we're going to be putting out information around, and Ladue's doing the same thing, like what families are going to commit to the learning at home. And then we're also putting things out to our staff to see who is going to commit to being, who's requesting a virtual option for instruction. And then what we're going to have to do is going to be like one of those, like, let's see what our needs are and let's see how we can fill it in, and then come up with the solution. It's going to be like putting a puzzle together, but I think that we feel very confident that we would be able to do that, and having some different teachers from Ladue that I think would also help make that puzzle easier. And I think that that we can't really make that decision until after we have all that data. And so what I would say is that we want to know it as soon as possible, so that way people can start making their plans and they get the right training, but we'll be putting that out this week. And we will have a deadline. I will just say that too. We'll have a deadline as part of that, so that way we can have enough time to make those decisions without people keep coming in.
So just to maybe comment on that answer, which is what I expected it to be, I think it might be important to clarify. We're not going to know entirely what the staffing of those online classes are going to be until we know, number one, how many students select them, and number two, how many staff we have that wants to do that. So I think it's important in the communication of that to the community that people know that it's aspirational, really, right? That we would have Clayton and Ladue teachers teaching those things, but we don't know for sure until we know what the need will be. So I just think that we need to manage that.
Yeah, no, I think that's a good point. I appreciate that.
So, and then we'll see. I mean, it's a complicated puzzle. It's not just a puzzle. So we'll see where we are. Those were the kind of wanted to make sure I understood kind of questions. I don't know if we're going to have more. We're going to talk about other topics, or more our thoughts too. But those are the things I wanted to clarify first. So
no, that's good. Yeah, definitely. I want to have an opportunity for the board to give input. And I guess one of the things I would like to have is some reassurance that you would support this plan. And so that's the other thing that I'm looking from the board.
Thanks, Gary.
I have another question.
Well, can I get to Kim first? Just
Yeah,
'cause-
sure,
let me
I
go.
can't see the whole screen, so I don't know
Yeah,
what hands
yeah.
right now.
All right, go ahead, Kim.
Hey, morning, everybody. Sean, thank you for the update. And one of the beauties of going last is a lot of the other board members have already asked the questions that I otherwise would have asked. So I appreciate everybody's feedback. Sean, one of the things that you said as you gave your presentation is that whatever the district decides to do, we want to make sure that we're the very best at it. And I guess I just want to caution us all, both as a district and a board, of throwing that term around loosely when it comes to this, being the very best at it, because I would say that in comparison to the larger whole. We did a good or an adequate job in the spring with our virtual learning. But I want to make sure that as a board and as a district, we're managing, and I think David said, it's all about expectations and managing expectations, that we're managing the expectations of the community, that in addition to school looking very different for students and for teachers and for everyone in the fall, we want to be the very best at this, but we may not, out of the starting gate, be the very best at it.
Mhm.
And I think that that's an important distinction to make, is Clayton School District is known for its excellence and being good at a lot of things, but we have to learn how to get good at this. And that's a different kind of message than, we're the very best at it. We want to be the very best at it, but there's a learning curve that our teachers have to go through, our students have to go through. And one of the things that I think that we can become the very best at, and hopefully sooner than later, is that managing expectations piece and the communication piece. And it's so important now, especially because of all the uncertainty. One of the things that I know the U City School District is doing is after the announcement comes out on Monday, they already have signups for both the virtual town hall and a limited in-person town hall to collect input from the community and basically give the community at large a chance to, ask questions directly to the administration and to the board about, what the learning at home plan or the responsive learning plan looks like. And I think, taking a cue from them and from others as far as how we really engage our larger community around this is maybe important, especially as we move forward. And then the only other things that I would ask are, as far as very best at it, and some of these questions are already asked, how will we do that? Professional development, sorting teachers by risk factors, skill sets. I mean, my own children's experience for sure in the spring were that there were some teachers that the virtual learning, they just knocked it out of the park. I mean, they excelled in that environment as far as engaging students. And then there were other teachers that probably needed a little bit more professional development and training in order to be able to thrive in that environment. So, and again, it's a learning curve to get everybody to the point where they feel comfortable in that environment, because it's an environment we could be living with for, an extended period of time. And then the only other thing is on the social emotional learning, you referenced the panoramic survey data. I just want us to all be cognizant that survey was taken at a different snapshot in time and a different baseline of what students' emotional state was in their learning environment, given that it was in school pre-pandemic. And I want to make sure that we're not assigning too much relevance to that particular data set as we come back and are trying to address the social emotional learning needs. So, toward that point, when it comes to social emotional learning, or even just the academic baselines, I think there probably will have to be an extended period of time as kids come back to school, figuring out what those new baselines look like. Because it's not just that school looks different in August, but school really has looked different since March. And that's almost a 6-month period. And so that's just going to be very different. So that's it for me.
Thanks, Kim. And I appreciate that input. And maybe what I meant to say is that the best we can be, because there is definitely a learning curve to this. And we know that that's going to be a process. And so, but I just want us to hold ourselves up to that expectation, is that we always are going to try to be the best we can be for our students. And I'm sorry I didn't highlight that, but that was part of our communication plan, to have virtual opportunities and virtual question and answer opportunities as part of our communication plan. And then when I talked about the panorama, it wasn't about using the other data. It's about using that mechanism, using that to get the baseline now to about what needs. So that's just, so it's not about using past data, about like learning what people need now in order
Perfect.
to be successful. So sorry I need to clarify that.
Jason, I know you had a follow-up question, and maybe Staci, you have another one too. So go ahead, Jason.
Yeah. So 2 questions, man. So are we going to be following like CDC guidelines, and is there any flexibility for someone to not abide by some of the guidelines that we put in place when we make our decision? That's the first question.
So we are going to adhere to CDC guidelines, and if someone feels that they are not able to adhere to those, we would have to look at the reason why and if there's a reasonable accommodation to that. So you know, there's going to be expectations that we have to adhere to for everyone's safety. And if people are feeling like they can't adhere to those, then we need to know the reason why and address it. But yeah, we'll adhere to those.
Right. So, yeah, because I'm just assuming that there are people who I know in the district, who I just know in general, who don't really believe still with all this that's happening that wearing a mask is even necessary. You know, the other thing is legal liability for allegedly not being able to perform or provide adequate education this year, right? So like, could someone sue us for not being able to provide adequate, you know, instruction? And have we thought about that? And because it's a gray area, it's subjective.
Yeah. I think it's a good question. I think that we've had conversations around that. I think that the one thing that you know, I brought up is that we may have to differentiate for students that have IEPs. And so what we might do for students who are who need more service minutes, we need to figure out a way that like, their day may look very different than other kids' day. They may not be able to, you know, to have virtual instruction. So we may have to say that actually they're getting services in school. And so we are, so that's where we have to do that differentiation and look at where we are legally liable to provide services and ways that we can be creative about that. But yeah, I mean, we have, you know, everything is new. So we don't know what that, you know, when we're looking at liability, we definitely are having conversations with that. We had a meeting just recently with superintendents with some attorneys who are giving us some guidance on how to move forward and got some information from them. But yeah, we are thinking about that, but I feel like we can put some things in place to make sure that we don't get to the point where people are feeling like they're not getting good education or their minutes.
All right, and one last question. So what if a child gets hurt in school? How does it, number one, how does a nurse attend to that child under COVID procedures? And yeah, that's my question. How does the nurse deal with that? How do we deal with that? How do we deal with bringing, you know, other folks coming into the building? If you know, because that's disruptive if it's happening in the classroom. You know, emergency response has to come in the building and have to do something. Nurses have to come in and have to provide, you know, CPR, whatever the case may be. So have we thought about that type of situation?
We actually wrote a plan that has to deal with all of those. So we have health clinic procedures. We have plans for what if happens, you know, when a student needs to be sent to the nurse, when students need to be treated in the classroom, when students need to be excluded from the classroom, how do they get their daily medications? How do we deal with students that have ongoing medical needs? And so we have a plan that we have put in place that is going to address all those questions and have it here. So those are things that we are thinking about. You know, when you're talking about the students getting hurt, like we have to, we don't want, you know, normally if a kid need to go get a Band-Aid or something, running down to the nurse's office to get that, we can't do those types of things anymore. And so we have to put the right measures in place to be able to handle that.
Gotcha. That's it.
Staci, you had another follow-up question?
Yeah,
Go ahead.
yeah, I'm sorry. I actually had two more questions, but Sean, you kind of just answered one of them, which was our IEP students are one subgroup of our student population that I'm actually most concerned about. You know, so many of those kids depend on support classes during the day, co-taught classes, even one-on-one, you know, shadows and support throughout the day. But I was happy to hear what you just said, which is that their schedules might look differently to accommodate their minutes and their needs. So So thank you for paying attention to
Yeah,
that.
we're working closely with special school district, and they are willing to be flexible with us and actually to provide any PPE that we need to make that happen as well.
Okay, that's great. And my second comment or question was that I think one of the issues in the spring was that parents felt this immense pressure overnight to become homeschool educators. And I was glad to hear you say that Milena has a document with expectations for everyone. And I believe you said that's including parents, right?
Yes.
Okay. Thank you for that, because I think that will alleviate a lot of stress at home when parents realize that they are, you know, what their role is in this.
Yeah, she divided it up into like stakeholder roles, like the students' roles, the teachers' roles, the families' roles. And we want to make sure that people, I think the other thing too is that when I talk to parents in the spring, is that it'll help too, is that there are some parents who felt like they needed to be with their child every single moment with them on the computer, and that's not maybe not as necessarily, it depends upon the student, but it's you know, I just think that will help parents feel a little bit more like, okay, this is what the expectations are.
Sean, are you able to put that in when you solicit the survey? Because I think it's important that people understand that whenever they're opting in versus out.
Yeah. And so we're thinking about how much information do we need to provide our families so that way they can make an informed decision around what it looks like with the opt-in. And we're framing it as the opt-in, like it's an opportunity versus like you're opting out of the education. So
Anybody else have any other questions?
I think
No,
the one thing, Joe, that I would ask is that I guess what I'm asking, you know, we're gonna have to make some really difficult decisions in the next couple weeks. And I guess that I wanted to hear what the board's perspective was on what I talked about, is that, and I'm, again, for all those people who are watching and for the board, I'm not saying this is the reality that we're gonna go remote starting off, but that is a reality. And I keep thinking about, like, how do I get the long-term dividends of having students in our schools as much as possible? And would having starting remotely 5 days a week with really dedicated times throughout that first quarter where people are coming into the schools, getting comfortable with the environment, looking at small groups, looking at assessments, looking at ways that we can do that safely to truly educate staff and families and students. So that way we have that investment of time at the beginning of the year that would then allow us to be more successful maybe than everyone starting on the same day. I'm just throwing that out there and just wondering what people feel about
Yeah,
that.
Sean, but before we get to that, can we pause and make sure nobody had any other clarification?
sorry.
Because I think Gary maybe had one, and actually I have a couple. I was just waiting for
I'm
everybody
sorry
to
about
answer their
that.
questions. So Gary, did you have another?
So I would say that I was going to bring some things up that I would not call clarifying questions, but
Okay.
just similar thoughts like that, like about what, you know, ideas about different aspects of this. So why don't you go ahead and finish, Joe, and then we can move to that.
Okay, great. So yeah, I just and thank you all for your questions. So I mean, a lot of my questions or comments were I think included in what you all said, but just a couple of things, maybe to questions and comments. One is I do think, to Kim's point, and kind of the community completely understanding what they're getting into. So for instance, I know in other districts, it's complicated to even think about the difference between remote learning and what you call learning at home. So really, how is that different? So I mean, I think to the granular level, folks got to understand what it is they're really selecting, right? Because if you're opting in to what we're calling learning at home for a whole semester, I think that's just really important for people to understand, even how that's different than remote learning, knowing that the likelihood of pivoting, at least in one building or more, to remote learning is high. So that's one. Two, I am, to your point about teachers here and across the country being concerned. I'm just wondering about our contingency plan. You know, if we don't have enough staff, right? I mean, because that could change our plan too, right? If staff say, hey, I'm gonna retire early, I'm not interested, I'm gonna do Family Medical Leave Act, whatever. I'm gonna take some leave. You know, how do we address that? And then just two other things real quickly. You spoke to the lack of criteria, right? For you know, we don't have good federal criteria, and we might not have great local criteria. But is there a way, and I know the superintendents are talking about that, for folks in the community to understand better what those criteria might be, right? Just because that might be helpful. And then finally, just something about contact tracing. I know there are other districts that are basically going to one adult, one building because of contact tracing. And I wonder where we are that, meaning that you as the superintendent typically would go to all the buildings. There are some districts that are saying, nope, you can only go to one building. Because if you as the superintendent get sick and you've gone to all the buildings, that could mean that you got to shut down all the buildings. Same with SSD, same with service providers, same with shared staff. Are we thinking about you dedicate only, at least at first, to one building, because from contact tracing point of view, that's actually the only way you can limit an outbreak. So sorry, that's a lot of more comments as much as questions, but just some thoughts.
No, I appreciate that. And yes, I agree with you that we have to make sure that people know what they're getting into. And so we'll definitely have to think about the best way to communicate that in terms of selecting that model. We are meeting with superintendents this week to think about, do we create those thresholds, or do we come up with those kinds of opportunities? I have a small group of superintendents that are coming together to talk about that. I think, Joey, your point about the staff, we're working to, address those needs. And quite honestly, there have been some people who've decided they're not coming back as staff. And there's a lot of fear. And so one of the things I'm thinking about is like, how do I make sure that I'm mitigating that fear as much as possible for our staff? But the reality is that, and that's not unique to Clayton, there are going to be people who are not going to want to come back. And our sub pool is going to be depleted very quickly. And so, that's the other thing I've been thinking about is like, how's the best way to address that? And so, our staff is really, really dedicated. And, I feel like they are, even the communications I get is that they feel like, this is something that we are really uncomfortable about, but we also know that we're dedicated to our students. But the reality is that, that's why I put in one of those conditions for us to go in between those phases is staff. We may not have the staff. And then in terms of the contact tracing, we do have, I hear that point. One of the measures that we already currently have in place is that every person who comes into the district, and we do this every time we come to district, they have to fill out a form and let us know where they are in each building, where they're going to be in the district. So we know who's in each building every single day. So that way it can help with our contact tracing. But your point about maybe just assigning one person to one building to limit that is a good idea.
Thank you. So maybe now we can, and Gary, you could start us off if you want, kind of broader thoughts.
Sure. It goes along. One thing I wanted to talk about does kind of go along with the concept of contact tracing and those kinds of things, but I'll put it in a broader category of what resources we are bringing to bear here. Not that I want anybody to think I want us to spend more money, but I think the idea of only having to spend, you know, $500 to $750,000 additional to respond to this would be, I mean, I would be ecstatic if that's what happens on the other side of this. But I think we probably should be willing, again, I haven't said this out loud to anybody, so I don't know if we'll all disagree with it or what, but I think we should be willing to spend more money in more areas to respond to this. And I think, you know, staff for contact tracing, or, you know, staffing or whatever, I don't know if that's outsourced or how you do that, might be one. I have to ask, should we be thinking about, and I have no idea what the question to this, should we be thinking about testing facilities? You know, it's really frustrating in the context that we're in, that our country, our state, our city, our county still does not really have that adequately under, you know, resources implemented for that. In my family, you know, 3 of us went and got a test at St. Louis County because some St. Louis County was saying, if you're interacting with people at all, come get a test. We have facilities now. Well, it was 2 weeks ago, and we still haven't heard any results. It's just kind of absurd. Like that, if it's that, there's not enough resources there to really provide meaningful information. Should we be thinking about spending some money on that and testing our staff and you know, things like that, testing other people that district personnel interact with or whatever? I think we should be looking really hard at resources to support people who need to choose the remote learning. And not every family in our district has the same you know, level of resources to do that in the same way. And you know, we talked about an equity lens on this. That's part of it. It's not the whole thing, but you know, should we be thinking about how we can be spending money on those kind of resources to support that? I don't, again, I'm just opening up a can of worms here, I realize, but those are all things that specifically about resources that I've been thinking about and wondering about what we can do to do this in the best possible way, knowing that we can't do it perfectly or, you know, with it being absolutely right. So having thrown those things out there, I'll just let you all respond to them, I guess.
One question for you. I wanted to pick it back on what Gary just asked and mentioned about expenses. So our expenses could be going up, and what's happening around us is affecting our revenue over the course of time. I know we had an influx of tax cash coming in, but I'm saying, how are we looking if we have to spend, you know, $700 to $1 million on infrastructure for the foreseeable future, which could be 2, maybe 4 years, right? How does that even look? What kind of expense is that? And have you, I'm sure, have you all put up some kind of mock pro forma to just to have an idea on what that looks like? That's my first question.
So to Gary's points about, you know, like looking at different resources and you know, I think that's actually where I'm needing some support too, in terms of if the board is willing to utilize some additional resources, but you also need to know what that impact is going to be on our budget. And so I would say that with the fund balance that we currently have, I feel that we can do a long-term kind of impact. And if we have to do, and Mary Jo can do that projection of like, if we have to spend this amount of money for the next couple of years, that we wasn't planned, how is that going to impact our long-term impact and also a long-term fund balance? And then the other thing too is that there's going to be some factors that we still are not aware of how that's going to impact us. So we can do some projections around if revenues go down because there's not as many people leasing spaces that are in our areas. Those are things that we can definitely look at. There's a lot of unknowns, but we are aware of that. We haven't done that long-term projection yet, but I'm talking to Mary Jo. We feel that, if we had to, we still would be healthy in terms of our fund balance if we spent this money this year. But we can definitely do that. look at long term.
And just another question just to piggyback on that is PPP money. Like that's drying up based on what I'm hearing from the federal government. Is there any more money available that we don't know about, or are they going to reopen that this fall? Is there talks about that at all? So, I mean, you mentioned earlier about having access to that kind of capital. I think you mentioned that, right? Was that?
Yeah, we
Yeah.
did receive some funds that are allowing us to do, that allowed us to do the architect review, looking at PPE.
Yeah.
And we've been using that funds. We had about $96,000 that we received. But that doesn't go, I mean, we purchased masks for all of our staff. I mean, that's not going to go a long way.
Right.
And so there's going to be some long-term impacts.
Mm-hmm.
The other thing too is like when you were talking about, we may have to make special accommodations for the type of PPE equipment. So like some people might have to have clear masks because some of our students might need those accommodations for reading lips, and so those are the kinds of things too that we have to take into consideration.
Gotcha.
Other thoughts? Anybody?
Yeah. So Sean, you were asking about our perspective on the notion of a quarterly kind of a slow reentry, for lack of a better word. I think it's an interesting thing to consider. I kind of see where your mind's at and where your thought process is. And I can't say I completely disagree with it, but I will say that, speaking from a parent's perspective at the Gulick household, our remote learning experience was horrible. And so any notion of that going forward is just horrific for us. And so, I know it's mixed. I've read the reviews. I know everybody has a different experience, but it kind of touches on what Joe had said. There's got to be a pretty, the communication that comes out has got to have a very, very well-defined contrasting, explanation of why this would be different than what we had in the spring. Because I mean, you and I've talked about it. We basically had 5 YouTube videos a week to watch. That was our learning, and a single touch point with the teacher to make sure everybody felt okay. And so I'm very nervous about a remote option. And I stay as connected as I think I can from the science side of it. And I'm personally not concerned with our boys attending school if we have distancing practices. My kindergartner wears his mask probably better than his parents. I'm not naming names here, but it's, I think, I'm excited at the prospect of these guys learning a new normal in school. I know that my perspective isn't shared by everybody in the community by any stretch, but before I could be supportive of a remote option, there would have to be something around the framework that helps me understand why it's not what we experienced in the spring. And then even then, of course, there's a personal component, because I will say, and I'm not too prideful to say that our particular jobs don't support it, so we will be in a position where we've got to figure out, whether or not one of us takes a pay cut and, to manage that, or we change something else in our budget to facilitate a nanny. It's just, it's something that our employers were patient with us for, quite a while, because everybody in the world was dealing with it. And not to say that won't be the case either, but there is a real impact for us if our kids are not in school, because we're a dual income, dual working parent household. And God forbid, a single income, single parent household. I think that's even more traumatic. So I know these are things that are weighing on your mind. I just lend a little bit of a voice from our perspective as a family.
And I appreciate that. I know that other community members share those same feelings, and I will say that we are it would have to be different than what we did in the spring. And I think, again, we use the term emergency remote learning. We've had time to plan what it would look like, and we've gotten feedback about what it would need to be. But we also know the hardships on our families and being able to be able to manage that. And I definitely know that. And I think the thing that I keep thinking about is like, I mean, I want the kids to be back in school too. Like, I definitely think that that's really important. And so as a leader, I'm trying to figure out what's the best long-term way that we can make that happen. So that way we're not having interruption, like let's start, but then have to stop because we have infection, because we didn't do enough in terms of health promotion, or having to go through the phases so often because we weren't preventative enough. And so that's the part that I know it's a hard pill to swallow, but I wonder about, like, is that investment going to be helpful for us long term? Because the reality is, this, as I said earlier, this is not about 2020-21 school year or just the first semester. We're having to make some decisions that are going to be long-term impacts in terms of way we teach students. And even if a vaccine comes out, there's still going to be people who are going to be, worried, and we still are. And so it's just, so I'm trying not to just think in the here and now, but I'm trying to think about the long term.
So, hey, Sean, like real quick on that point, I wonder if, the idea that you were floating about what we do this first quarter it was more remote and all the implications of that. Again, not to like throw out a can of worms, but would it be closer to that if more people chose to do remote learning or learning at home, because we gave them the option of not committing for the semester, but maybe just the quarter? And so would we default closer to that because more people would start at home for this first quarter and then give us time to do some of the things that you were talking about? I mean, I know that that's complicated with like course selections and stuff like that.
Yeah.
But,
No, that's something to think about. Yeah, and the other thing too is that if which way we start, I think it's going to be important for the board to know that I don't think that there's any other way beyond a hybrid or remote at this point. I think that I need to be upfront with you, is that a 5-day a week for all students K-12 is not going. I can't see how that's actually going to work and be viable, based off of the study that we've done and social distancing, and so I just want to be upfront with people, and I'm going to say that Sunday, Monday in my video to the community, that that's very likely that we would have some type of, if we were going to start, it'd be a hybrid.
And Sean, are you assigning different risk factors then to elementary age, K-5 students, and you are middle school and high school students then, as you're talking about that hybrid model? Are you prioritizing, or is there an attempt to prioritize the in-person learning for the youngest students over the high school students, which already have developed a degree of academic independence?
Yes, and so we know that it's going to be very important for our elementary students to have more of a consistent experience, just because of they're not as independent. And so when we were looking at different models, I mean, we have explored models where it's hybrid for 6 to 12, and in 5 days for elementary, because we can maintain cohorts easier at the elementary level than we can at secondary. And the other thing too is that the way we use space because with the space analysis, it makes it easier for us to have students on an everyday basis at the elementary level. So now that is also dependent upon the total number of students who are going to choose that return. We got some data saying that there's a good percentage of people who'd want to choose that learning at home, which would reduce the total number of students in our schools. And that's where we would potentially need additional staffing, because we could be spreading students out to different parts of the building that we wouldn't normally be using for instruction. So, so I think that they are different than at the elementary level and the secondary in some ways. Does that make sense? Yeah.
Sean,
Oh,
sorry. I just want to add in a general sense, you know, change is hard, but I think that there were a lot of aspects of traditional education that were kind of ripe for disruption right now. Anyway, I'm serious. I think about that in our strategic plan, you know, we talk about personalized and individualized learning, and the investment we're making in both the professional development around virtual learning or hardware such as cameras in our classrooms or whatever it may be, I truly do think is an investment into the future of education. And when we think about our strategic plan and we think about personalized and individualized instruction for our kids, I think this has forced us to think of ways to be successful with that. So I think we should all not just look at this as only a solution to this pandemic, but I think it will push us forward in education forever. So I think it's important to think of it that way too.
No, I think that's really important to have that mindset. And we share that mindset. And we've also gotten feedback from students who have said, this was really highly effective for me. Like I felt like I liked having some choice. I liked having some different type of a pace. And so, but no, I think that's a really good point, Staci.
Jason, did you have something else you wanted to add?
you know, I did, but I forgot what it was.
Okay.
It'll come back to me.
Okay. Anybody else? I might just jump in and say, Sean, that from my perspective, I do want to underscore what Gary and others have said. I do think if we need to make an additional investment to support our staff, to support state safety, to Staci's point, to invest in the future of education, I hope we do. Okay. Right? We should not be penny wise and pound foolish. Obviously, there is some threshold which we can't afford. I get it, but we are very fortunate to have about a 40% fund balance, which is a heck of a lot higher than the threshold upon which typically it's 20%, right? 22%. So I'm not advocating that we spend it all down, but I do want to make sure that we're not holding back. If we really need to invest in a place.
I appreciate that. And I also want to make sure that that helps, but I also want to make sure that when we're looking at all of our resources, not just like purchasing things, but also our human capital, like how do you repurpose different positions? I want to make sure that we're being cognizant of that as well in these decisions. But that helps me because I feel like we're not gonna not do something if we're not gonna not explore something just because of the cost. If there's something that we feel is gonna be really beneficial, something that we'll explore it and then see how we can fit it into our budget.
I do have another question. Space, we may not have adequate space if everyone were to sign up. I'm assuming, right? If everyone were to sign up and say, we want to go back to school, or we want to be in school and have in-school learning. Have we thought about maybe looking at inventory around the community that's available? Inventory meaning retail spaces that are vacant, available, that we could probably tap into for nominal cost and train and teach there. I mean that may not even be. And it may be an insurance issue, it may be a workers' comp issue, it may be a lot of legalities that we might have to hop through, but is that something you looked at?
So we've had that idea floated before, and we've also talked about what, if in doing something like that, we would have to think about there's not only the space, utilizing different space, and then there would be an addition of staffing that would be able to. So if in order to decrease the amount of students, you have to add staffing. So it's basically adding additional staff. And so, I mean, which would be a pretty monumental if we're thinking about teachers, because that's a huge part of our budget. It would be, increasing our staffing budget pretty significantly. But we have talked about that idea. We haven't explored even spaces. But that might be something that we would consider in the future. I have thought about different places that are in Clayton that might be places that we could utilize in terms of space. I've even thought about, like, are there places that aren't being rented right now that might be actual places that we could tap into? So no, but we haven't done anything specifically with it.
Yeah, I mean, yeah, and I don't want to try to hammer this out now. But I'm just saying, like, I was thinking about, like, kids zone tutors, and there being an instructor in one space, but then, like, the tutors are there to kind of help keep the kids in order. And so it's a different wage, a different salary, different wage of instructor, but it's more remote learning and someone helping keep the kids on task, those who need to be in the classroom. But it was just a thought.
No, I think that's a really good point, because the other thing that we've talked about is, and when you said that, like, there's ways that we could have, like, and I'm not saying we're doing this, but like a reverse kid zone, like, instead of after school and before and after school, like, how to get people during the day that could support our students who just need to have someone being with them to do the online learning. And then the other thing too is that finding a spot that we could do that. And so yeah, those are ideas that we have explored in terms of utilizing staff in that way.
All right, cool.
Kim, you had something, I think?
Yeah, Sean, I was just going to ask, like, what about the Great Start program, in the summer, the kind of quick start programs for summer school? Are those still going to proceed kind of as planned, or will you use that as kind of a test case for making a final decision in August about which of the responsive learning options actually get used? Do you have an update on what's happening with summer school and summer academies?
Yeah, and so we have had conversations about that, and we are going to put something out this week that we are thinking about moving to a virtual model for both of those courses, the ESA and for the Great Start, just because of the increase in cases recently. And so we're just so we'll finalize something by Monday, but it's that is more than likely we'll be doing some virtual, utilizing those virtually.
Any other questions or comments for Sean? I do want to say, Sean, I think you've done you and the staff have really done a great comprehensive job. So thank you. I know this is
that means a lot to us.
Yeah, uncharted territory. So thank you for doing such comprehensive and impressive work here.
Joe, can I add that I had an action item on here that was a MOU, but I had to pull it off because there was a mistake in the actual MOU, and I didn't want the board to approve it without the right information in it. So I pulled it off the agenda last night. And so and that MOU was going to be part of that University of Missouri virtual model. And so we still have time to do that. And so I just want to let you know, I'm just going to put it on the August 4th meeting as an action item, if that's okay.
Great.
I just didn't want the board to approve something that didn't have the accurate information in it.
Well, thank you. We appreciate that. So I think if nobody has anything else, and Sean, you don't have anything else, I think really it's adjournment. So is there a motion to adjourn?
So can I just say, so people are feeling good about this model moving forward? I mean, okay, so I just want to make sure I feel like I have some board support. Okay.
You have support.
Sean, I want to make sure the model is good. I don't, I see it coming together, but I feel good that you all are actually doing the work to figure out, to explore what is the best process to make this thing happen. Because just like you say, it's still up in the air. You don't know what's going to happen in 2 weeks, for example, with COVID and positive cases and what the county's going to say. So I feel confident in that you are doing what you need to do,
Okay.
using the data that's out there to make the right decision.
Okay. All right. Thank you.
Thanks.
I'll just underscore that as well. I'm sorry for not saying that before. I appreciate the work that you've done and the model that you put together. And I also appreciate the fact that we took time to have this this input for the board and this time. I think that's something that the community should, deserves and expects for us to all be a part of this and to have input into what's going on and in getting feedback from lots of different people that have lots of different opinions about this, as we've all heard. I think it's important that we be taking that into consideration. So.
Yeah, and I appreciate you saying that, Gary, because I also need to make sure that you are informed and in the know, so that way when those questions come to you, you can answer them. So.
What I will say too, I mean, like what Kim was saying about what some other districts are doing in terms of giving time for feedback and stuff. If the board, I mean, not to volunteer everybody else's time, but if we need to be part of that and to be in those forums and help answer questions or take difficult feedback and difficult questions, I mean, I think that's, that I'm certainly open to that and being a part of the process of communicating to people what the plan is and answering these questions and asking our own questions and not being afraid to do that. So lean on us in that way as well.
I appreciate that.
Appropriate.
Thank you. All right. Thanks. Sorry, Joe, I didn't interrupt.
Not at all.
We can move to adjourn too if you want to. So.
Yeah. Does anybody have anything else? I just want to make sure before we move to adjourn.
Thanks, Sean, for all your hard work.
Thank you. I need to make sure you guys know it's a team effort. This was not an individual.
Your team too, and thank you for involving the teachers.
All right. I think we can move to adjourn.
All right, I'll move that the Board of Education adjourn.
Second.
All in favor?
Aye.
Bye.
All right. We're adjourned. Thanks again, everybody. Really appreciate it.
Bye, y'all.